The orthotic was fairly easy to get used to. Over time, maybe it's a 1 to 2 week adjustment period. Probably be shorter for other people, but I didn't care for it. But I got used to it over time, and the hardest part for me was just understanding that I was going to get the result. Because I'm a very result-oriented person, and it's something that I was going on faith at that point because I didn't know anybody else who'd ever done this, and it was a whole new experience for me. So that was probably the toughest part for me, because there's sometimes when you're like, I sure hope this works out, because one way or the other, I'm committed to it. That's when it started, when the orthotic went in, and I probably wore the orthotic for nearly a year. It's not overnight. He had told me that some patients experience it immediately. I noticed it gradually over time. The orthotic, of course, is, it's an orthotic. It's foreign to your mouth. It's something you have to get used to. It's not something you'd want to have in your mouth, in my opinion, for long periods of time. I mean, years. You wouldn't want to stop there. It's a transition, but there are some trade-offs with it. You have to take it out to clean, and and it does make you a little self-conscious when you're speaking with people, because you have they don't understand, and it does give you a little bit of changes the way you speak a little bit. So you have to understand that it's even though the good things are going on, it's kind of like you're under construction. That's the way I approached it. So over maybe the first 3 months to 6 months, it gradually got better for me, and the bite was realigned, and I would come in and he would do the procedures that would allow them to adjust the orthotic. And that's a process where they come in and they measure me and my bite on a computer, and they slowly move my bite over time with the orthotics so that it would be ready to accept the veneers. And that was a challenging process, and it will be for anybody who does it. And but I would say I started believing in the process, if you will, 100%. Maybe probably in the first 3 to 4 months, and I noticed an improvement over that period of time. But I wore it nearly a year. It's more like milestones. You're like, there's adjustments when that are done with the orthotic, where you feel better with the musculature in your neck, your jaw, and your temple, all your neuromuscular, all your cervical area. And there's that, and then there's the good feeling you get when you take off the appliance, or the I forget what it's called off the top of my head now, the retainer, and then that's another step. And then when you go through the having your teeth prepared and fitted for the veneers, that's if you do a full restoration like you did with me, then you have to prepare the tops. Then the tops get temporaries, and then the temporaries go away, and the full veneers come in. And then there's a healing process there, and then there's you do the same thing with the bottoms. And then once you're done with that, you have to get used to the cold, and you're pressure sensitive and you're temperature sensitive with foods and things, and water and things of that nature. And you have to go through that. And those are all milestones. And when those go away, you feel better each time. Okay. But people need to understand that there's maybe a half a dozen things that they'll face. And if they know that going in, then when they hit them, it won't be as much of a surprise. For me, a lot of it was I didn't expect, and I had to learn. But I was so I was far enough along in the process, and I had good support at home, and I had good communication with the doctor that I understood that we were still going to get to the end, but in a positive way. But it was kind of, there was some faith there. The adjustments are so small. He told me something that has always stuck with me, that a millimeter, as it relates to your mouth, a millimeter is like a mile, and a millimeter is about 38 thousandths of an inch, I believe. And that's a tremendous amount of precision that goes into this process. And if you don't have faith in that, then that it's going to be something that is going to be done very specifically. This is engineering almost. If you have to understand that it's going to be different for every person. The way my mouth and my bite is designed is going to be slightly different. Everybody's a little bit different that way. And but the one thing I'll say about Greg or Dr. Eckert is that he's very precise guy. He's very detail oriented, and he's a good listener. And it's something that, and the staff and everybody who's attended me throughout the process did a very good job of listening. But also, I was always assured that he was going to get it right at the end, and that because once you have the veneers in place, for example, then you have some speech issues, you have some eating issues. You have to retrain your mouth a little bit, because your teeth have been restored to the point where they're usually longer and thicker. And then you have to make sure that if you're a speaker like I am, I'm in sales and marketing for a living, I have to be able to explain, and you don't want to be walking around with a lisp, where your teeth can directly affect that, your new veneers can. And so I went through that as well. And that was really challenging for me, for a guy who uses this part of my body to make money. But it's all been adjusted, and I feel like I've gotten to the point where I'm as good as I ever was, as far as that, plus all of the benefits of the bite and the restored cosmetics.